Hi, my name is Alex Mahone, and we're presenting the communication portion of this TeamSTEPPS program.
Hi, my name is Alexandra Otto. I'm a first-year pharmacy student.
Hi, I'm Jorge Carrera. I'm a first-year MD PhD student.
Hi, once again, I'm Alex Mahone. I'm a first-year MD student.
Hi, I'm Kelsey Hobson. I'm a first-year physical therapy student.
Hi, I'm Kayla Milford. I'm a first-year PA student.
So communication is a process by which information is clearly, accurately exchanged between individuals or groups through a common system of symbols, signs, or behavior. It is a process by which information is exchanged between departments or organizations. It can be verbal, nonverbal, written, symbolic, or behavioral. And issues involving communication were attributed to 66% of reported problems between 1995 and 2005. And it was among the top 3 causes of reported problems between 2010 and 2013. Effective communication is essential to effectiveness of a team and ensuring patient safety. There are 4 aspects of communication that are needed for it to be successful and effective. First, it should be complete. The message should include all relevant information. It should be clear. The information should be presented to be understood. It should be brief. The information needs to be presented concisely, and it should be timely. Information exchange needs to be within a reasonable time frame and with verified authenticity and validated information. Effective communication is the lifeline of the core team, and it is effective when it permeates every aspect of an organization.
The barriers to communication include inconsistency in team membership, lack of time, lack of information sharing, hierarchy, defensiveness, conventional thinking, complacency, lack of coordination and follow-up, distractions, fatigue, workload, misinterpretation of cues, and lack of role clarity. An effective strategy for communication is known as SBAR. SBAR is one strategy that provides a standardized framework for members of the healthcare team to communicate about a patient's condition. SBAR is an easy-to-remember tool that is useful for framing any conversation, often a critical one requiring a clinician's immediate attention and action. In phrasing a conversation with another member of the team, consider presenting the following: situation, so what's going on with the patient; background, what is the clinical background or context; assessment, what do I think the problem is; and recommendation, what would I recommend?
There are additional mnemonics that we can use to help with effective communication. Those are anticipate, share cue, and IPASS. For anticipate, the A will stand for administrative data, the N, new clinical information, the T, tasks to be performed, I, illness severity, C, contingency plans for changes. And for the share cue mnemonic, S stands for situation, H, hit for history, A for assessment, R for recommendations and result, Q for questions.
A call-out is a strategy used to communicate critical information. This specifically can be best for emergency situations because it allows clear roles for each team member and allows everyone to anticipate the next steps to take. A checkback repeats orders for clarification and can be super helpful to prevent errors, especially if the call is not face-to-face. A handoff is a transfer of information during transitions of care. This includes opportunities to clarify, confirm, and ask questions. Transferring responsibility and accountability between team members is a verbal acknowledgement of this transfer. This aims to eliminate uncertainty of roles. So pass the baton ensures that everyone is on the same page and reduces the risk of error. It is important to introduce yourself and state your reasoning for the contact. You want to give the person all the information you have so they can take on the responsibility as effectively as possible.
And so all of this accumulates into why communication is important in the medical field. Medical errors are for a large part because of miscommunication. One way to measure this are called sentinel events, which are events in which patients die or receive severe injury, either physiological or psychological. It's been reported in 1995 to 2005 that miscommunication was the result of 66% of these events. And from 2010 to 2013, it ranked in the top 3 causes of sentinel events. But with proper communication, good outcomes come too. You get improved teamwork, clarity of information relayed, effectiveness of information relayed, maintains teams properly informed, minimizes mistakes, promotes discussion and possible solutions, and most importantly, it keeps the patients safe.